A member of the Schweitzer Advisory Council, and as a fellow for life, I would like to welcome you to the 2010 Schweitzer Annual Event.
Through Schweitzer, I've learned so much about how much trust it takes to develop a project in a community, and what a long process that is, but how rewarding it is.
We have these housewives staying at home taking care of the kids and neglecting themselves. And I thought that this would be a good way to take the women out of the house and kind of make themselves feel important and that they're worth something. So I actually was able to help a woman get out of an abusive marriage, and she was able to go to a crisis center and get help for that, so that was really cool. And we also had a weight loss challenge where one of the women lost 16 pounds.
Like pin the vulva on the vagina and STI basketball. So that did the trick. No, it really works.
The Schweitzer Fellowship really just gave me an opportunity to work with people like FB who, most of us don't come in contact with ever in our lives. And for this reason, I guess people like stories like hers and stories like that I've heard are going to stay with me forever, and hopefully continue to work with communities like that I've worked with this year. So thank you.
We set up a violence prevention program at Loyola in the emergency department for patients who came in with street-related injuries, and counseled them and their family members kind of on diffusing gang retaliation, which usually happens right at the onset, as well as setting them up with other social resources such as drug rehabilitation, finding jobs, school credentials, etc., so that they can continue their life outside of the hospital. And that was the hospital-based portion of it. And then we had a community-based portion as well, where we set up educational workshops on the medical and social implications of gunshot injuries, as well as other health issues that were peculiar to that specific population.
I would say 9 out of 10 could hardly even say a sentence about the condition. So we started there, and I saw many of these patients 3, 4, 5, 6 times, and we would do repetition. And I found the more the individuals could really learn about the pathophysiology behind their conditions, the more excited they got, and the more empowered they became about being able to actually control their condition.
In terms of sustainability, just this past week, I met with some other yoga teachers and healers in the Chicago area to begin conversations of starting a nonprofit organization that would help bring some of these healing modalities to the communities in need. And I had no idea where that would come from when I started this project, but my Lamborghini has arrived. I look forward to doing this work. Thank you.
Massage students from the school that I go to offer a day of massage at the space, and one woman who received the massage was just weeping by the end, and I was walking around as a translator, and she said to her massage therapist that this was the first massage she's ever received in her life, and for most people it was the first and only massage they've ever received. And she said this was a gift for every birthday of her entire life. 2 years ago, her husband was deported, and she's been taking care of her 2 kids with physical and developmental disabilities, and just has incredible challenges on a day-to-day basis. And to see the strength come out of this community has been so inspiring.